Welcome to our Mary Greeley Primetime Alive program. Welcome to Medicare. I'm Vicki Newell. I manage the program here at Mary Greeley. As a reminder, if you want to sign up for other programs, would like to join Primetime Alive, you can go to our website, mgmc.org/PTA. Our presenters today are Joan Grabenstetter and Bruce Johnson. Joan is a retired physician who has been a SHIP volunteer for 6 years in Ames. Whoops, I don't know why that's advancing, sorry. Joan is a retired physician who has been a SHIP volunteer for 6 years in Ames. Prior to that, she practiced obstetrics and gynecology at McFarland Clinic for 33 years. Bruce Johnson is a retired director of laboratory services, having worked in that capacity at McFarland Clinic for 28 years and at Story City Memorial Hospital for 8 years prior to that. He has been a SHIP counselor in Ames for 10 years. We're going to have Bruce go first with his presentation, so please welcome Bruce.
Thank you, Vicki. For those of you on site, you have probably picked up a packet of handouts that we have. You'll look through the packets and you'll see a number of generic handouts, including a presentation feedback form. Sometime before the end of the presentation, we'd like you to fill out the feedback form and leave it on the back table. There are a couple of generic handouts called a checklist for people with approaching Medicare eligibility and getting ready to retire. We'll go over most of the information on these two handouts. You can use these later on to refresh your memory. There's another handout called Medicare Preventive Benefits that we'll probably talk about very briefly. And then more specific handouts regarding Medicare prescription drug coverage, Medicare supplemental insurance programs, and Medicare Advantage. And Joan will talk about those in her portion of the presentation. As Vicki indicated, my name is Bruce Johnson. I'm a SHIP volunteer, and I work here at Mary Greeley Medical Center. Joan Grabenstetter, my colleague, will be presenting as well. She is a SHIP volunteer down at Green Hills Retirement Community. So you can find a SHIP volunteer at a couple of different places in Ames, wherever it's more convenient for you to go, whatever works for you. Joan and I sort of wear two hats. We work for SHIP, which is a service of the State of Iowa Insurance Division. The acronym SHIP stands for Senior Health Insurance Information Program. The operative word there is information. Because we're confidential, we're free, but most of all, we're objective. And that means we're going to give you information about a variety of issues related to Medicare, but we're not going to recommend or suggest or encourage you to enroll in any particular plan or program. Our hope is that we can give you enough unbiased information so that you can make informed decisions on your own. And this is moving itself forward without me telling it to. So the second hat that we wear is that of the Senior Medicare Patrol, SMP. In Senior Medicare Patrol, our intent is for you to learn to protect your Medicare information by not giving out your Medicare number indiscriminately to individuals, detect whether you have incurred any problems with your Medicare billing by looking at your reports that you get back from Medicare periodically. Make sure that everything that's been, all the bills that have been submitted to Medicare are bills that you understand. If you detect anything that's incompatible with what your memory serves, report it. Find out how you can get information about whether it's potentially fraud or abuse. Somebody inadvertently, yeah.
Is it still advancing on you?
It is, yeah, it is.
I think the PowerPoint that was sent to us has preset advanced slide advance to it.
And if we go to the other page, which is the end show, and go here and unclick use timings.
There you go.
Okay.
Tim was going to do that for us, but I'm glad to know you know how to do it. So.
I've been there, done that.
All right.
Okay. Okay. So today we're going to cover a variety of topics, including eligibility for Medicare, enrollment in Medicare, and then later on, when we get into a discussion of what Medicare is, we'll talk a little bit more about the costs involved with Medicare. Secondly, besides eligibility and enrollment, we're going to talk about Medicare, your choices, one of which is going to be original Medicare, which includes Medicare Parts A and B, where the government pays for some of your healthcare costs, supplemental insurance, which can help you with your out-of-pocket expenses, prescription drug plans, which can help you with your medication costs, or the alternative to original Medicare, which is Medicare Advantage. So eligibility. Who is eligible for Medicare? Primarily, you have to be or first and foremost, I guess I should say, you have to be a U.S. citizen in order to qualify for Medicare, or you have to be a permanent resident for at least the last 5 years. If you meet those qualifications, then you can enroll in Medicare if you're age 65 or older. You can enroll in Medicare if you're under age 65, if you stay with me on this. Okay. If you meet qualifications by having one of these three conditions, disability, Lou Gehrig's disease, or end-stage renal disease, and you're under 65, you can qualify for Medicare. So let's talk about enrollment in Medicare. That's eligibility. Let's talk a little bit about enrollment. This is a little bit more extensive. But let's consider a couple of different scenarios. First scenario, you're age 65 and you're going to be retired. You're going to reach age 65 and you're going to be retired. You're not working anymore after age 65. If that's the case, you enroll in Medicare, then Medicare will be your primary coverage. You should consider enrolling in both Part A and Part B, the difference between which I'll be discussing upcoming here. And be aware of the fact that if you don't enroll during immediately after or within a certain window that I'll talk about of your 65th birthday, you could incur a penalty of having to pay a higher premium for Medicare. If you have a retirement health insurance plan from your employer, that is to say, health insurance that you have because you're retired, not because you're actively employed, then be advised that this will pay secondary to Medicare, and you want to make sure, as Joan will discuss a little bit later, that you compare the benefits from the retirement insurance with what other options you have being retired. Second scenario, you're going to work beyond age 65. Assume you just love your job and you want to just keep working ad infinitum, but you're going to work past age 65. If you're working past age 65, we have to explain what we mean by work. Work means, as I kind of alluded to a little earlier, active employment. That means you're actually going to work, or you're on vacation or sick leave or whatever, but you're actually actively employed by your employer. That's considered work. If you're actively working for an employer when you turn 65, or your spouse is actively employed and you're covered under his or her benefits, then you're considered actively employed. If your employer has 20 or more employees, then you have to know that your employer is required by law to continue to offer you your health care coverage. And if that's the case and you elect to keep it, you can do so, and this may offer you an opportunity to delay enrollment in Medicare. If that's the case, your employer coverage is primary, Medicare will be paying secondary. And in this case, you can delay enrollment in Medicare Part B without penalty. You want to keep evidence of this coverage because when you finally do enroll in Medicare, they may want to be sure that you were actively employed. If your employer has fewer than 20 employees, then your employer is not required by law to continue to offer you your health insurance. If they do, offer you health insurance, their insurance may pay primary or it may pay secondary. And if they do offer you your health insurance to continue, if you continue working with them, then again, you can delay Medicare without penalty. When you delay enrollment, we're talking about two different parts of Medicare that I'll be explaining upcoming here, Part A and Part B. Part A, should you delay enrollment in Medicare Part A? You can if you want to. If you qualify for what we refer to as a premium-free Part A, which I'll explain in a little bit, then you can delay Part A with no penalty. However, typically we will advise clients of ours that usually, not always, but usually there's no good reason to delay enrollment in Part A. There's no premium in most cases for Part A, so it's considered free, quote unquote. And it gives you a Medicare number, so you're in the Medicare system. But the one situation where we tell people they want to consider not enrolling in Part A, go ahead and delay it, is if you have a health savings account. Now, not all employers offer health savings account, but if you have a health savings account, then you're no longer eligible to make contributions to that account once you enroll in Medicare Part A. And be advised that they will delay Part A predate Part A for 6 months. So if you're going to enroll in Part A, you want to do so at least 6 months after you stop making. Hello. I hope the people at home aren't hearing that. So you can delay Part A if you want to. If you have a health savings account, seriously consider not delaying Part A. Seriously consider delaying Part A if you have a health savings account. If you don't have a health savings account, you can go ahead and enroll in Part A anytime. If you do delay, there's no penalty if you enroll down the road. Part B is a little bit different, works a little bit differently because of several conditions. I'm going to there. You can delay Part B if you're employed and you're getting benefits from your employer, health insurance benefits from your employer, and a lot of times there are good reasons for doing so. Part B coverage, first of all, is something that's going to pay secondary to your employer coverage, so it may not be needed. Your employer coverage may be covering everything. Secondly, once you enroll in Part B, you have to start paying a monthly premium. Currently, that's $164.90 per month per person. That amount will change annually depending on cost of living. Lastly, Part B, the effective date for Part B will trigger a deadline during which you can enroll in a Medicare supplemental insurance plan with no penalty. It gives you a period of time during which you can get a guaranteed issue into a supplemental insurance plan. So if you enroll in Part B, but you're going to continue to work with your employer and get the benefits from your employer, you've already triggered that 6-month period for enrolling in a supplemental insurance plan, and it may expire before you're ready to retire. So if you delay Part B, that 6-month period of time, deadline period, is delayed as well. So that's a good reason for considering delaying Part B if you're still employed with benefits from your employer. When you finally decide to retire, then you can enroll in Part B at that point. If you haven't enrolled in it already, you'll have an 8-month period of time to enroll with no penalty after your retirement. But remember, you can enroll in Medicare Part A anytime in most cases. Anytime you have an opportunity to consider delaying enrollment in Medicare, always verify that decision with Social Security. It's the Social Security people who are the gurus in Medicare enrollment, because when you enroll in Medicare, you will do so with the Social Security office. If you're a person who's already receiving Social Security benefits, that is to say, you get a monthly Social Security check, or railroad retirement if you're a former railroad employee, then you will automatically be enrolled in the Medicare program, concentric with your 65th birthday. If you're not receiving Social Security or railroad retirement benefits, then you need to contact Social Security or railroad retirement yourself. And you can either do so in person. There's an office in South Ames, and I'm unsure at this point whether they're accepting walk-in visits. They used to. Or you can go online to the Social Security website, ssa.gov, or you can call them and enroll in Medicare. ssa.gov. So, when to enroll in Medicare? Well, if you're a person who has turned 65 and you're retired, then you need to know that there is what's referred to as an initial enrollment period for Medicare. This is a 7-month window that brackets your 65th birthday month. So it includes the month you turn 65, the 3 months prior to that, and the 3 months following that. Again, a 7-month window bracketing your eligibility month, which is to say your 65th birthday month. If you don't enroll during that period, if you let that lapse, and if you're a person who is not working beyond age 65 with benefits from your employer, then you can access what's called a general enrollment period. The general enrollment period occurs during the first quarter of every year only. So during those 3 months, you can enroll in Medicare. It will become effective the first day of the month following when you enrolled it. But be advised that if you have missed that initial period and you've missed the special enrollment period by enrolling after you've retired beyond age 65, you could incur a late enrollment penalty. And this late enrollment penalty will stay with you essentially the rest of your life, or certainly as long as you have Part B coverage. So you could incur a late enrollment penalty if you miss either the initial enrollment period or the special enrollment period, which occurs after retirement beyond age 65. So we're talking about enrolling in Medicare. What does Medicare consist of? Well, as you're probably aware, Medicare is essentially a health insurance plan offered by the federal government. And the federal government offers help in payment for our health insurance costs in what they call 2 parts. Part A is that part of Medicare that's typically referred to as hospital insurance. This will cover you for hospital inpatient care. And the operative word there is inpatient because, as you know, probably, you can be in a hospital for short periods of time, but not be admitted technically as an inpatient. You're there under observation, or you're having outpatient services performed in a hospital environment. In those cases, you're not an inpatient. Part A does not pay for those services. Part B might, but Part A will not. Part A also covers such things as skilled nursing care, which you can think of as sort of a rehab facility. If you were officially a hospital inpatient and you need to be discharged into a rehab facility that's a Medicare certified skilled nursing facility, then Part A will pay for those services up to a maximum number of days. Part A will also help pay for things such as hospice services and home health care. Part B, on the other hand, is typically referred to as outpatient health insurance, medical insurance. Part B will pay for your visits to a doctor's office. It will pay for visits to an outpatient therapy clinic, like a physical therapy clinic, something of that sort. Part B will also pay, for what's referred to as durable medical equipment, which can include things such as wheelchairs, crutches, CPAP machines, things of those natures, which are durable pieces of equipment. Part B can help pay for those. Part B also can pay for home health care if it's prescribed by your outpatient provider. Part B can also pay for ancillary services like laboratory radiology services. So I mentioned earlier that there's also some costs involved with Medicare. One cost is upfront, and that's a monthly premium. If you have Part A, and if you have worked for 10 or more years and have accumulated what they refer to as 40 quarters of Social Security work credit, which equates to 10 years, then they say Part A is free. Well, we know it's not free. We've been paying into this as we've been working. But what they mean is that there is no monthly premium for Part A. It's considered a premium-free Part A. So if you enroll in Part A and you qualify by having 40 quarters of Social Security work credit, then ongoing, you will not have monthly premiums to pay for Medicare Part A. As I kind of alluded to before, if you're receiving Social Security benefits, you'll be automatically enrolled in Medicare Part A. And again, it's free as long as you have accumulated those 40 quarters of work credit. And if you delay it and you have premium-free Part A, then there's no penalty for late enrollment. Because we're talking about the federal government, bear with me on this, they're confusing because Part A is different than Part B. And so it's going to be a little confusing because the business about enrolling in Part B works a little bit differently than it does for Part A. First of all, Part B does have a monthly premium. And currently, for most of us, that premium is $164.90 per month. I think I mentioned that a little bit earlier. But if you're a person with higher incomes, there might be a higher Part B premium. Now, when we talk about Medicare paying for our health care services, on average, you have to remember that Medicare pays roughly 80% of your health care costs. It doesn't pay the full cost. It pays roughly 80%. We're supposed to be responsible for the remaining 20%. And that can either be paid out of pocket or it can be paid using some of the helpful other programs that Joan will be talking about in her session. Now, this 80-20 split between Medicare and us is not technically 80% and 20% of the full cost of a service, not necessarily at any rate. It may be, but usually it's not. It is instead 80% and 20% of what Medicare refers to as the allowable cost of a service. And I typically use an analogy of a service that you would go to a physician for which the physician would normally charge $150. If you're a Medicare beneficiary, the physician bills Medicare. Medicare may look at that and say, no, we're not going to pay that. It's too much money. We're only going to allow $100. So for this $150 service, $100 becomes the allowable. And of that allowable amount, Medicare will pay 80% or $80. And you'll be responsible for the remaining $20. If the physician is a physician who accepts assignment, a participating physician is the other term that's used, then that means the physician has signed a contract with the feds, and this contract states that the physician will accept no more than the allowable amount for the service. So if you're seeing a participating physician, then you will not have to pay that extra $50 in my hypothetical scenario. They will get written off by the physician. You'll pay only the upfront deductibles and any 20% co-insurance that may be there. If the physician is not participating, may still be a Medicare qualified physician, but they have not signed this contract with the government, then they're allowed to charge an excess amount, but they're limited by law on how much excess. And that limit is 15% of the allowable. So if you visit a non-participating physician for my hypothetical $150 service for which Medicare only allows $100, then Medicare will pay $80. You'll be responsible for $20. The physician can bill you for an additional $15, and in this case, writes off the $35 that's left over. So they will not charge that full excess amount. Be advised that there is a third type of provider out there that you may run into from time to time who wants nothing at all to do with the Medicare program. These providers may advertise their services using phrases like, "We do not accept Medicare patients," or "We do not bill Medicare," or something like that. These are not Medicare, these are not physicians with Medicare numbers. And oftentimes it's because they don't want to deal with the bureaucracy involved with Medicare. If you see one of those providers, they will bill you for the full $150 in my hypothetical, and you furthermore cannot be reimbursed for any of it by Medicare. Now, having said all of that, the good news is that every physician in central Iowa is participating, so this is not usually an issue. But you need to be aware of it in case you get referred to some Timbuktu clinic for some specialized service. You may be dealing with one or more physicians at that location who are not participating in the Medicare program. And you can find that out ahead of time if that happens to you. So, I mentioned earlier that if you have higher income, you may be subject to a higher Medicare premium, Part B premium. The flip side of the coin also takes effect. If you're a person with lower income, you may qualify to get help from the government for these Medicare costs, the upfront premium costs, the copay costs, and so forth. We can help you determine this in the SHIP office. You can contact Mary Greeley to speak with one of us in this office, or Green Hills to speak with Joan or her colleague down there, and we can help you with these situations where you might need help from the federal government if you have lower income or resources. So, if you're comfortable going on with Medicare supplemental insurance, Joan will take over at this point and talk about your other options under original Medicare, plus your alternatives to original Medicare.
Okay. Hi, I'm Joan, and we're going to go on a little longer about original Medicare. Part A and Part B are the basics of Medicare, passed in 1965, and as you can see from looking at the brochure we gave you on supplements, it has all the costs, the deductibles and copays on Medicare. Medicare has never paid for everything. So supplemental insurance to fill in the gaps has been a thing from the beginning of Medicare. Prescription drug coverage did not come into being until later. Okay, this is not advanced. Oh, here we go. The alternative to original Medicare is Medicare Advantage, where you also have to be in A and B, and we'll talk more about that in a few minutes. Now, why would you stick with original Medicare? Because people who like original Medicare like the fact that there's no network. You can go to any provider in the U.S. who takes Medicare, and you don't need referrals. So if you have a problem you want to go up to Mayo for, there's no hassle doing that. So Medicare supplement, if you stick with original Medicare, as we mentioned, it doesn't cover everything. You have copays, deductibles, and these insurance policies are sold by private insurance companies, and because like most insurance, they're very complicated. So Congress standardized the policies back in the 90s. And at this time, there are 10 standardized policies. What you have to know about Medicare supplement is that it's a contract that is guaranteed renewable. As long as you live, you can have the same supplement. If you buy a policy plan G now, the insurance company cannot make any changes in it, they can't drop your coverage as long as you pay the premium. That would be the only reason they could drop if you failed to pay. So that's a little different than the other products we're going to talk about. So these are guaranteed renewable the rest of your life. There are a number of letters of policies out there that people own that are no longer sold. But if you know people who bought Plan F in the past, they still have it, and they will still have it the rest of their life, even though it's not being sold to younger people going on Medicare at this point. So they're guaranteed renewable. The important thing to know about supplements is the guaranteed issue, okay? When you first join Part B, when you sign up for Part B, and Bruce did refer to this, either at age 65 or at a later age when you join Medicare, you have 6 months that you have a guaranteed issue, and that means that you can buy any Medicare supplement you're interested in of any of those 10 plans from any company that you want to, and they can't ask you anything about your health, and they have to give you the preferred rate. You can't be turned down. After the guaranteed issue is passed, you're subject to medical underwriting. So they will ask you about your health, and it doesn't mean that people can't buy supplements in the future, but they're not going to get the same deal. They're usually going to pay more. So we tell people to think about that if you're buying a Medicare supplement, think about the fact that you may be marrying this supplement. It's not an easy thing to change, okay? If you had a stroke next week, you probably would have trouble getting any kind of supplement in the future. As far as pre-existing conditions, as long as you apply for the supplement within 63 days of going off your previous coverage, you don't have any waiting period for pre-existing condition, as long as you haven't gone uninsured for any significant length of time. What about a retiree health plan? If you have retiree health plan available for you, you're going to want to compare it to a Medicare supplement option. Now, they vary quite a bit. Some retiree health plans like ISU are actually secondary coverage. They cover some things that Medicare doesn't. But people pay a good high premium for that. And some people, it's not in their budget, and a regular Medicare supplement might be a better deal for them. So you can compare cost and different things for your specific retiree health plan. Many retiree health plans bundle in the drug coverage, where you don't get a separate choice on a drug coverage. They've decided it for you, whereas the state of Iowa changed that, and now people can pick their own drug coverage if they prefer. So this is something for people to look at before they make the decision, because once you're on the retiree health plan, if you change your mind in the future and decide to drop the plan, you will not have that guaranteed issue to buy a supplement. So what kind of deal you get will depend on your health at that point. Okay. Next, we're going to talk about drug costs. So if you're sticking with original Medicare, in the early 2000s, Congress created Medicare Part D. It's available for anybody on Medicare, either Part A, Part B, or both. And just like Part B, there is a late enrollment penalty for people who go uninsured and then want to join, okay? So you are not subject to the late enrollment penalty if you have other coverage that's considered creditable, which means it's as good or better than a Medicare drug plan. And that would include your VA benefits, your TRICARE, your employer or the retiree coverage. It will vary, okay? Most of it will probably be creditable, but you have to check. Don't assume it's creditable. If you have creditable coverage, your employer is supposed to be sending you notice of this. Your insurance company, I should say, is sending you a notice every October. So if you continue to work after 65, you will get this notice that confirms that you have drug coverage and we encourage people to keep the notice in case they need it to prove that they won't be subject to a late enrollment penalty when they need a drug plan in the future. So what is the penalty? For Part D, it's 1% of the base premium for every month you were eligible and didn't enroll. And that's tacked on to your Medicare costs for the rest of your life. This example is somebody who delayed 12 months. And it's based on what the base premium or average premium is in the country for this year, $33. So as premiums rise, the penalty rises, just like for Part B, it rises with the increase in premiums. So I see clients who are not on any drugs, so they will ask, why do I need to enroll in this? Well, obviously, you buy insurance for something that might happen in the future, but the good news is that in Iowa, the lowest cost drug plan this year was only $4.80 a month. So it does not cost that much to have basic coverage. And then your Part D plan is not like a supplement. You're only dating it. You can change it any year. You can enroll in a drug plan the same times you can enroll in Medicare. Now remember, if you enroll in the 3 months before your 65th birthday, the plan will be effective the first of the month that you turn 65. That's the way insurance works. It goes from the first of the month to the end of the month. If you enroll after your birthday, you have to wait till the next month for your plan to be effective. If you don't get that done and enroll within 3 months after your 65th birthday, and assuming you don't have coverage during this time, then you have to wait for open enrollment. Open enrollment is the same dates every year, October 15th to December 7th. At that time, you can enroll in a drug plan if you didn't get it done the first time. You can disenroll, and you can change your drug plan during that time. And that's set up that way because Part D drug plans are run by private insurance companies. They're allowed to change everything from year to year. They change the premiums, the copays, the deductibles, the formulary, restrictions, the pharmacy network. But you can change your plan. And of course, your drugs may change over time. If you are on nothing and next year you're on Eliquis, it makes a big difference in your cost. You can also join an Advantage plan for the first time during open enrollment. You can disenroll from your Advantage plan, and you can change your Advantage plan during open enrollment. If you do nothing during open enrollment, your coverage stays the same. We encourage people to review their plan during open enrollment to see if it would make a significant difference to them to make a change. Special enrollment. So the person who retires at 68 or 70 has 2 months to join a drug plan, 63 days. If you move, your drug plan is based on living in Iowa. If you move to another state, you need a new drug plan for that state. You have 2 months to do that. If you move into long-term care, nursing home, or skilled nursing, you can change your drug plan. When you move in, you can change it anytime you live there and when you're discharged. This doesn't apply to assisted living. Apparently, when this law was passed, it didn't exist. People who qualify for extra help can change their drug plan, and they can change their drug plan on a quarterly basis if they have a reason to. What if you're still working and you check and your employer coverage is not considered creditable, but it's meeting your needs, it's meeting your spouse's needs? This is another situation where you should delay enrolling in Part A, because just enrolling in Part A, even though it's premium free for you, is going to trigger that late enrollment penalty in the future when you retire and need that Part D drug plan, okay? So check on that situation before you make a decision to enroll in Medicare. Part D premiums, mentioned them changing, and this is another situation where if you're high income, you get to pay more. So this is called the income-related monthly adjustment amount. It's based on your tax return 2 years previous. So every fall when you get your letter from Social Security, it tells you what your benefit's going to be next year. It will tell you what your Medicare premium is going to be. And if you're subject to paying extra, they'll tell you how much, and they'll tell you how they calculated it, okay? And this is recalculated every year. It's not permanent. If you had an unusual year that is not typical, there is an appeal process. Also, people can qualify for extra help with drug costs, and the threshold of income to qualify for extra help just with your drug cost is higher than the threshold for other help with Medicare costs, which is also higher than the threshold for Medicaid. And SHIP counselors help people figure out how to get that application done. And this extra help can be very useful for people. So we said Part D has a lot of moving parts. There's the premium, the deductible, the copay. All of this information is available on the Medicare.gov website. It's called the Plan Finder. It has all the Part D plans on there. It has all the Medicare Advantage plans on there. You open an account so they know who you are, where you live. You put in your drug list. And I like to help people show them how the Plan Finder works. And many people nowadays can do this on their own in the future. But we have many people who prefer to come to our office during open enrollment and review their drug plan in the future. Last year, SHIP volunteers saved Iowans $20 million on drug plans by having them switch to a different plan. A lot of people don't realize sometimes the formulary will drop a drug. That can make thousands of dollars a difference. Sometimes it's hundreds because the network has changed. If your pharmacy is not in network any longer for your plan, this can make a big difference. So the Medicare.gov Plan Finder is very helpful. And it's also very good for Advantage plans because it will show you exactly what each one of your drugs will cost on each given plan. And it will show you month by month and pharmacy to pharmacy if you can compare several pharmacies. Okay, I'm not having luck here. Drug plans. We have to talk about Advantage. So the alternative to original Medicare is Advantage. Who is eligible? Anybody on Medicare, but they have to live in the service area of the plan. And this is based on your county of residence. And it's where you live. It's not where your doctor lives, okay? This is a private solution. Insurance companies typically will set up plans in multiple locations, contracting with medical providers. And then they have contracts with Medicare that are on an annual basis. It's sometimes referred to as Part C because this was created in the late 90s when managed care became popular as a way to insure Americans. These are managed care plans. If you enroll in their plan, they are required to provide you the Medicare services, but your services are being administered by a private company. They are interpreting the Medicare rules. And if they turn down a claim, the appeal process is set up by the individual company, so it will vary from company to company compared with original Medicare. Okay. Most of the plans do include drug coverage, and as noted, they have a lot of extra benefits that they're allowed to put in their plans because these were set up like the health maintenance model and to improve the preventive benefits in Medicare. Now, there were more preventive benefits added to original Medicare in 2010, but there's still more in the Advantage plans. When you enroll in a Advantage plan, you do have Medicare coverage, you're still paying for Part B, and you are getting your care through a private company. The way it works, if you enroll in the Advantage plan, Medicare is actually paying this insurance company in advance for your care on a monthly basis, based on the average cost of a Medicare beneficiary where you live, and with additional funds if you have certain more serious health conditions. And then they are obligated to pay for all these different services, but normally they require copays for the services. So if you're looking at Advantage plans, and we gave you a whole brochure about them, I want to mention that this is published by the SHIP office in Des Moines every year in the State Department of Insurance with information on what Advantage plans are available to Iowans for the coming years. So this will be revised for 2024 sometime later this year. It's available to look at on the SHIP website. It's available to order a copy, and it's available from SHIP offices because it's about 50 pages. It has the basic information about the plans, the difference from original Medicare to make sure you're clear on that before you join a plan, and then it gives you a description of what is a health maintenance organization, what is a preferred provider organization, and then lists all the plans. With their service area, you have to only look at plans that you're eligible for. But if you look at a plan that covers your service area and looks good to you, you have to be sure that your doctors and hospitals that you want to use are actually going to take the plan. And don't forget about the dentist, okay? You don't want to join a plan, then find out you have to find a new dentist that will take the plan. And then the deductibles, co-insurance, co-payments for services. People who like these plans like the pay-as-you-go feature of it. They can have a monthly premium. The ones that do, it's usually a modest premium. But we have a number of plans in our area that have no monthly premium. Instead, you're paying when you access care. So that can be look good to somebody who is relatively healthy because you're only paying when you actually get seen by somebody. And the copays for services are different with different plans. And then you have to know something very important, the out-of-pocket maximum cost. So Medicare will point out to people that if you're on original Medicare, you just sign up for A and B and don't buy a supplement, there is no maximum of what you're liable for. Okay, that's why people buy supplements. But in an Advantage plan, there is a maximum. Now, this year, the government has set it can't be higher than $7,500. We don't have any local plans that are quite that high. We have them up to $6,700, and we have a lot of plans that are lower than that. So this relatively healthy person who figures this is a good deal, no premium, other than what you're paying for Part B, of course. But if you have to be able to handle the maximum for the year if you have a serious illness or injury. After you reach the maximum out-of-pocket cost, and this is for medical care, your drug costs don't go into it, unfortunately. Once you reach that maximum, the plan has to cover everything until January 1st, and then you start over on the maximum cost for the year. Oh, shoot. And then you have to check if the plan has the drug coverage if you need it. People on Advantage are not eligible usually for a Part D drug plan. But there are plans that don't have drug coverage. They're designed for people who don't need it, usually veterans. You can join an Advantage plan the same time you can join Medicare at 65 if you're retired, or any year during the fall open enrollment, you can join an Advantage plan for the first time. There is never any medical underwriting for an Advantage plan. As I pointed out, they get paid extra if you have health problems. And this is why during the fall, you are going to see a lot more ads for Medicare plans. These are for Advantage plans. Some of the ads I've been asked about on daytime television offer a lot of free stuff. They don't make it clear that you have to qualify, maybe by where you live, maybe by your income. They're national ads, and they'll have an 800 number that's labeled as a Medicare helpline or Medicare hotline. Why is that? The law is that they're not allowed to call you directly unless you're a customer already. But if you call their 800 number, they can give you a sales pitch and they can do follow-up calls. So that's why that happens. We encourage people to do your shopping and decide who you want to talk to in advance. So during open enrollment, special enrollment means somebody who retires at 68 or 70. They can join an Advantage plan for the first time. The same time you can join a drug plan, you can join an Advantage plan. You should know that during open enrollment, you can change your Advantage plan and you can disenroll. The first 3 months of the year, people on Advantage also are eligible to change their Advantage plan or to disenroll. The thing is that if you've been on Advantage more than 12 months, you would not have a guaranteed issue to buy a supplement at that point. The only exception where people get a guaranteed issue back and they are covered in the book is somebody who moved out of the service area. They would have the alternative of a guaranteed issue versus a new plan. We're also going to mention cost plans. I should back up here a minute. Anytime you're on a network plan, you do have a right to urgent or emergent care out of network. So if you're traveling or you're hit by a car and you can't get to the hospital you're supposed to be seen at, they do have to cover your care, even though you're in a network plan. On the other hand, on your own, going out of network because you want to see a different specialist, if you're in an HMO, health maintenance organization, you don't have coverage out of network. If you're in a preferred provider organization, it's more flexible to go out of network at a higher cost to you. You should know that many Iowa Advantage plans do have contracts with Iowa City for referral care if you need to see a specialist that isn't in network. Until this year, there were no plans that had contracts with Mayo Clinic. This year, there are 2 that do. I can't tell you for sure that will continue. Networks can actually change at any time. So in the booklet, we also have information on cost plans. Cost plans are also network plans where you have to live in the service area. They've been around longer than Advantage. They are not being paid in advance. They make their claim to Medicare when you get care. They're not available everywhere in the country, but in Iowa, we have 2 different cost plans. Unfortunately, if you live in Story or Polk County, you don't have access to a cost plan any longer. But if you happen to live in Boone or Marshall or some other central Iowa counties, there are 2 different cost plans available to you. They have monthly premiums. The 2 plans are a little different on the premium. And in return for that, they cover your services, your copays and deductibles on Medicare with in-network providers. Medical Associates Cost Plan is the one that has the 5-star rating. 5-star Medicare rating is the highest rating. It's the only Medicare plan this year that has it. And the deal with that is people don't have to have an enrollment period. They can enroll at any time. They function like a PPO. If you go out of network, you're not liable for all the cost. It goes to original Medicare. Cost plans do not have a drug benefit, but people are eligible for a Part D drug benefit when they're on the cost plan. So we mentioned the Medicare website and the Plan Finder. The Medicare website has a lot of other information on there. It is a national website. I encourage people to take advantage of the SHIP website. It's on your brochure, the address. And the other things you can find on there are, there's a tab new to Medicare. You can find on there if you search for seminars, in addition to giving you information about in-person seminars coming up in the state, there's a link to an online video of this presentation if you want to review it or recommend it to somebody. It will tell you where every SHIP volunteer site is located in the state. And there's also a link to finding SHIP services in every state and territory in the country. There are SHIP services that are supported by federal grants. In Ames, there are 2 SHIP volunteer sites, one here at Mary Greeley and one at Green Hills. I work at the Green Hills Retirement Center. It's behind the Gateway Hotel, right off of Highway 30. Our phone number is 515-357-5000. Bruce is going to give you the number here for Mary Greeley. But before we do want to encourage you to fill out the evaluation and give us feedback on the presentation. And we are ready for questions, right, Bruce?
Yes.
And I am going to go around with the microphone to get questions. So if you have a question, you can go ahead and raise your hand. All right, we have a couple up front here.
So if you're still working, then, okay, I don't even know how to ask it. So the A and B, you don't have to sign up for if it's creditable, and how do you find out about that? You go to your employer?
Say again?
If I'm working and I still have insurance, I don't have to sign up. Let's say I want to work till I'm 70. So how do I find out if my insurance for my employer is creditable?
It's based on the number of employees.
Yeah, and your employer will know.
Okay.
And you will receive in the mail, right, a letter from your insurance company that tells you that it's creditable?
That's for drug
For
coverage.
drug
Oh,
coverage.
that's just for drug coverage. Okay. Okay.
I'll just chime in that when I was working and I was getting ready to retire and I was going to go beyond my 65th birthday, I went to my human resources department and I started to say, well, I understand that if I'm going to be applying late for Medicare, I need to have some sort of a letter. And the HR person finished my sentence for me. She said, yes, you'll need a letter of creditable coverage. And she pulled one off a stack and handed it to me. So I'm guessing your HR department will know.
Okay, thank you.
Incidentally, the phone number for SHIP at Mary Greeley here is 515-239-2322.
I want to say on that question, yes, if there are more than 20 employees, they are required to keep you on their coverage. What's the other thing I was going to say? I lost it.
At the start of
I know. When you apply for Medicare, when you do retire, okay, there is a form that Social Security has that you have to take to your benefits people to confirm that you had insurance.
Okay. So do I have to notify Social Security when I'm 65 that I'm still working?
Good question.
Yeah.
That's what they recommend, yeah.
Are you receiving Social Security benefits now?
No.
Okay.
The SHIP office in Des Moines tells us that it's always safer to confirm with Social Security that you are not required to enroll at this time because you're still working.
Okay, thank you so much.
At the start of the presentation, you said that people who are eligible for Medicare, one is a permanent resident for 5 years. What is a permanent resident?
Well, I'm not a governmental guru, but my interpretation of that is if you're a foreign individual, you've immigrated to this country, but you haven't met the requirements for being a citizen, right? You haven't met the citizenship requirements yet. You have a green card, I guess they call it, and if you've been a permanent resident for 5 years or more, then you qualify for Medicare.
There's got to be questions because this stuff, there's so much of it, right? You have a question?
Yeah. It says the 10 standardized policies and it lists them A through N. I thought F wasn't available for people, but it is available?
No, F and C, as in Charles, are not available to you if you turn 65 after January 1st of the year 2020. If you turn 65 prior to that, you can still purchase a Plan C or a Plan F, or a high deductible Plan F.
Is there an advantage to that, those two plans then, the F and C?
The follow-up question was, is there an advantage to doing that? There may or may not be. You have to look at what the premium will be. The only difference between a Plan F and a Plan G is that the Plan G does not cover your outpatient deductible amount. So if your outpatient deductible is X per year, and if the difference in cost between a Plan G, annual cost between a Plan G and a Plan F is greater than X, then you might be money ahead by going with the G. You understand what I'm saying? Okay.
Typically, you're going to pay a higher premium for more comprehensive coverage.
You get what you pay for.
And I should have mentioned, SHIP volunteers do have a plan finder, which is available just to us in our offices for supplements. And since we've had that, it's been kind of cool because we can help people narrow down the companies that they want to contact. Because there are so many in the brochure that as you can see. What the plan finder will do, if you've decided that you're interested in Plan G or N, it will rank them from lowest cost on up. And then it saves you some time.
Okay, all right. Thank you.
And I have to put in a plug for our ship counselors, not only here, but at Green Hills. They know a lot of information. They go to a lot of training before they can ever become a ship counselor. And then annually they have, and as they always remind me, they have the Des Moines office is a great resource, because sometimes, I can't believe it, they get stumped as well and they're not quite sure, but they know the resources, they know how to help you. And so I highly recommend getting ready to go on Medicare, or if you have any questions about it, and especially an annual check for your Part D to make sure that you're on your best plan. They are very busy during open enrollment period.
Usually we point out to people that they train new volunteers every year too, in case you're interested.
And yes, here, and I'm assuming at Green Hills as well, we are now have it open to schedule an appointment for open enrollment sessions. And so, yeah, they only meet with you about those dates, October 15th to December 7th. Yeah.
Well, we meet with people all year round, but yeah.
Well, but for Part D open enrollment to help with that, but yes, they meet with them all year round. Like I talked about getting ready to go on Medicare and that kind of stuff. But for open enrollment, we do fill up. We do fill up. So keep that in mind as well. Okay. Other questions? Here we go.
With the same insurance company, if you want to switch from, let's say, K to G or G to K, is there certain requirements, or can that be done just easily?
I can't answer whether it's easy, but you have to contact the company to find out.
I think every insurance company can make their own decisions on that, so you can't know, there's no blanket rule.
And we have another question back here.
Well, this may have been addressed and I didn't quite understand it, but I'm currently on just Medicare. And if I would decide to change to an Advantage plan, and 5 years down the road, I decide, no, I didn't really care to be in this position, am I allowed to go back to regular Medicare?
You can disenroll and go back to original Medicare, but you would not have a guaranteed issue for a supplement. So it might be, you'd be subject to medical underwriting. You might have difficulty getting a supplement from the company you wanted to, and it could be quite expensive at that point. So now, I think some people would like to know what is more cost effective in the long run. I thought it was very interesting that, being from McFarland, we have Schwab Financial, and they send out a magazine every so often. And their person said, if you're generally healthy, the Advantage plan may work out well for you, but you're taking a risk because you don't know how long it will last. Because obviously, if you're not paying a monthly premium, then at some point, and you have to pay more for your health care, so hopefully you're saving up all this money to use in the future, and all these people who have big health savings accounts, this may work well for them. If you already have medical problems that you get regular visits for, you're probably going to be more cost effective for you to stick with original.
I think a few people had that question, Carol, so thank you for asking that.
That was not my opinion. That was from Schwab. But I thought it matched my impression a little bit.
All right. Any other questions? And we do have two more ship counselors from Mary Greeley sitting back here. We have Twyla and Linda, if you'll raise your hand. So I know all four of them are, I'm sure, willing to answer some of your questions too, if you have once we've finished here. So
Are there any online questions?
I asked Tim, any online questions yet?
No, there aren't.
Nope. We're good there.
Okay.
All right. Well, thank you so much, Bruce and Joan. Great presentation. Yes, they definitely deserve that. A tough subject to cover because so much information to provide, and everybody's situation is just a little different. And but just remember, we have this great resource in our community, and no charge. For it, you just call us and we get you an appointment when we can get you in. So thank you. Want to remind you of our next program is Thursday, October 12th. So next week, 2 p.m. It's The Power Is Yours, Nutrition and Exercise to Reduce Breast Cancer Risk. And then I want to remind you of the Story County Senior Expo, Wednesday, October 18th, 9 a.m. to 3 p.m. out at the Gateway Hotel. I don't know if you've all been to it before, but it's a wonderful day. Lots of resources pertaining to older adults in our community. A great time to ask questions, to find out maybe about some new services in our community. So thank you everyone for joining us. Have a great day. Thank you for joining us online, and hope to see you next week.